I'm really glad to share the insight about the establishment of Institutional Animal Ethics Committee. This is a new committee that is established at the University of Rwanda. For this presentations, I will not teach animal welfare. I know some of you may be having different background, but even the experience working with animals in research education. So the intention of engagement is to share experience that we have at our university. As you know, the University of Rwanda is not a new, but has been revamped with a new law that was voted 2024. And that very new law has also established the College of Veterinary Medicine and the Animal Sciences, which came as a result of upgrade academic and the structural reforms of the old school of veterinary medicine that I had the privilege to lead for the last 10 years. This restructuring actually was supported and approved by government. Now we are the 7th College of University of Rwanda, and University of Rwanda has actually a vast community, more than 23,000 students. Then they are actually spread all over the country. We have almost now operational 9 campuses, and our campus in the Eastern Province makes one of them, which is located in the area, the high activity and the high, let's say, involvement of livestock sector, and the development that actually taking place is also very, very important compared to the other parts of the country. So in this new restructuring actually have seen our new college being given the opportunity to grow, but also the challenge to grow better and to comply with existing standards. And as we see our program also increasing, and the level of postgraduate program enrollment, but also in a number of new programs, that actually pushed us to react by proposing an establishment of a specific institutional animal use and care committee. And this committee was established in February, and we started by going through capacity building of members, but also making community aware of the existence of the committee, including the community outside our college, especially in the College of Medicine and Health Sciences, which are also starting new programs, research and postgraduate in transitional health, and also the use of animal subject in their research. So these are the let's say the drivers, but also the imperative that's compelled us to have this committee. So among the items of capacity building that took place very recently, you see, this is my friend, colleague, Dr. Jean-Claude, who was facilitating the orientation workshop. And we reviewed key items or key components. There are many areas of capacity building in this area, in the animal welfare, but also in ethics. But we concentrated, or we will focus on the 3 that's we think are basics for everyone who is working with animals, or everyone who is interested or intending to work with animals, either for research or either for education project. So we review animal welfare for animals in research and teaching as an introduction, and then we look at the constitution of this IACUC, but also the responsibility of the committee to have ensuring the welfare of animals in research and teaching. And then we look at the Animal Ethics Committee guidelines, how the project, how the research proposals are being reviewed, but also the process through which, and we see the steps, the key steps that each of the ethics committees should actually look at it in a way to guarantee or to preserve animal welfare. Why do we talk about animal welfare in research and teaching as we engage in research, as we engage in the experiments? So we should be aware and able to preserve animal care and also well-being. So we need to find a balance. Always researchers, they are advised, there actually is a requirement to seek the balance between where the objective of the research, the intention of the research, but also look at the level of care that animals that are being used are reserved and also deserve to be given. This ethics has been a lot discussed and arguments, and it's a controversial issue actually because some of us, or since the history, we have seen many academics, academia, or even research professionals using animals intensively, either for anatomical physiological research, even going to testing toxic substances. There's a level of extent that actually extreme are alarming to every user. That's why it deserves actually attention. If you remember the RD50, for instance, this little dose 50, where the animals are used to test toxicity of substances, the chemical, biochemical substances, drugs. So there is actually imperative to review our practices, our belief, to match it with the minimum requirement for animal care and also animal well-being. We will not in this webinar. We may not extend our discussion to other domain of animal welfare, like legal, like right, like philosophy. There are many aspects that are linked with uh, the um, the policies, the legal aspect. There are many aspects that are related with the production, with the economic point of view. But rather, let's focus on the physiological and well-being parts, and actually the mental being a part of this animal welfare. And I would like you to recall the welfare framework elaborated in 1979 in UK by the UK Farm Animal Welfare Council, where actually the the aspect of five freedom were harnessed. And if you remember at a school where we used to learn about the freedom from hunger and the thirst, discomfort, the freedom from pain, injury. All these five freedoms actually they make a compulsory package of what we are actually required to preserve or to observe for the minimum animal welfare and the animal ethics when we look with them. But later, we have also seen the improvement in the domain of animal welfare. The five domain going from physical, functional, and environment and behavior. All these in the top are contributing to mental domain of animal welfare, which is a mental domain. So this actually is to tell us and to remind always us that animals, they are sentient beings. By this characteristic, this um, it provides us with the obligation to look them like capable to experience positive and negative emotional states, being actually the basis of their welfare status in general. And this is very important. That's why we really need to keep an eye and also to raise our awareness around our community of research, community of educators we are. If we talk about animal welfare, of course, is very broad concept, and of course, one would whether would mind whether this can be immeasurable or can be stay like a theory, but there is a way we can assess actually the animal welfare, especially through environmental-based measures, but also animal-based measures. These are very specific, looking at the housing, looking at the provision of quality feeds and looking at the nutrition of feeds, looking at water and the quality of water. Look at there are many, let's say, elements of environmental-based measures, but also we look at animal itself, physiologically, health of the animals, look at the general conformation, the conformation score, looking at the behavior of status of the animal, irritability, and etc. etc. So there are a lot of a considerable number of parameters or indicators that actually are meant to establish whether welfare of the animals have been preserved or not. That's why there is imperative. There is a need to have a regulation, a regulatory mechanism. The regulatory mechanism at institutional level can be assured by institutional animal care and use committee or animal ethics committee. The same. There's actually the mechanism that's actually assure that throughout all the process of education and the research, animal welfare parameters have been checked and also have been approved or validated. These committees, they have to be specifically established. We look at the composition and the role of the members. We have seen that there is a common aspect, or let's say a common consideration that the committee has to include veterinarians. That a veterinarian is not by hazard, is not random. It's actually to profile this committee and to confront with the expertise that are required to look at the animal health, behavior, animal welfare parameters, and also the ethics of using these animals. That goes with using animals. And we have seen that also we have researchers in this committee, of course. Research team represented by the PI or principal investigator and a team with a safety staff. And we have seen also that we can have other non-scientific members to serve as opponent, as adverse opinion provider. And we have seen also other members. If we go in details, I was talking about veterinarian, of course, the mandatory. The mandatory has to be there. A scientist, a PI, non-scientist, especially we can look at legal office or ethical office, look at clergy if possible, where, for instance, animals are used in slaughtering, for instance. Some slaughterhouses or slaughtering facilities working with research, they prefer to include a specialist, a Muslim, to look at some standards, specific standards. For ethics, on our side, we prefer to include the membership of the Directorate of Research and Innovation, which actually oversees this committee. Non-affiliated public members, we have included, for instance, researchers from other institutions working with the university for diverse point of view, but also for inclusiveness. And the membership, the quorum, can be from 5 actually to some prefer 7, some prefer 9 or 11. So in the way that the number can be odd, that has to be odd number to provide for consensus when the vote has to be casted at the end of discussions. And this committee is vested with responsibilities. The main responsibility includes the program oversight, the protocol review, the facility inspection, monitoring research, and ensuring compliance. And all this actually, they are making the whole ethical review framework that is compulsory for any institution that is involved in research and education using animal subject. The committee is doing so by observing some key standards or guidelines and the procedures that's actually making an assessment guide. There are many proposed types of assessment guides and with different levels of compliance and the standards. And so when we can go through many links and find out what would be convenient and also what can be even adapted to your institution depending on the available resources, depending also on the level of research you are conducting. The process to which this assessment has to be done, it starts with what is a project looks like. So from the moment the IACUC members or committee has received a submission, so the process starts with looking at the justification of this project, whether the project is justifiable, whether the objective are really justifiable. Look at the purpose. This is actually a prime observation. And for some projects, even the process can stop by there. Instead of even without going through all the process and look at what will be the end outcome, the project without a justification, which is intending to use animals, this is not a good project per se, and the process should stop by there. And then after only that phase is passed, the project passed this justification, you look at the animal fare, look at the proposal, the methodology, look at the consideration for animals that are actually being used or even associated with the research. And then look at the legislation, look at the end at the 3 Rs. 3 Rs, principles, replacement, reduction, refinement. We come later in details to this because these are really very important assessment tool that allows objectively any IACUC to conduct an assessment that's yield let's say, recommendations that are really worth animal ethics and care. In this assessment, there is always a balance. There is a balance between the benefit of the projects, uh, can be education or research projects, versus animal welfare cost. And we see where this comes very important. It becomes important when you look at the decision making. The decision whether to approve or whether to refine or whether to disapprove the project is partly based on the principle of harm benefits analysis. So each project has to provide information on the scientific knowledge that is intended to be collected or to be produced, and the teaching value. It means the justification, the intention of the project, the justification of the objectives, and look at the associated potential harm for the animals. Look at the pain, the level of the pain, distress, the suffering to animals. So, a project is only approved if the benefits are really outweighing the harms. Otherwise, this project is not a good project to be implemented if the opposite situation prevails. The key information that the IACUC needs to collect from any project, and this information has to be also complete and clear. This information includes justification of the study, as I said. You look at description of the procedures, what will be done to each animal, the duration and the frequency of procedures. We look at the level of invasiveness, for instance, for surgical procedures, for instance. This information has to be as accurate and detailed enough. And the other kind of sort of formation is the animal welfare impact. When we come now, we look at the animal side. We look at the expected pain or distress. We look at the monitoring methods. We look at the endpoints, the human endpoint, how this project research team is actually intending or planned to go with the management of pain, management of distress of animals during the experiments. And then look at the personnel competence, the training, capacity building. Look at the level of education and the technicity, the competences. Look at the experience, look at the training, look at the supervision that is being provided to the project, the experiment. And this has to be also clear enough to assure the committee that everything will be done appropriately. And then we come with the 3 Rs. The 3 Rs, this is a very important and objective tool for assessment. And it includes replacement, reduction, and refinement. Replacement in the first instance refer to whether alternative protocols or alternative measures could be done without using animals. If this possibility, that possibility is given priority. For instance, an experiment which is intending to work with animals, but also there's a possibility to look at in vitro research settings. So in vitro will prevail over the live animals. Also, simulation can be another alternative. Simulation is possible, and then simulation can be used, for instance, for drug efficacy. Look at the vaccines, look at probably the nutritional parameters in the research. So if there is a possibility to use simulation or in vitro, that will be the most recommended option over the use of animals. So, and then the reduction, it will look at the minimum number of animals that have been used. If the research objectives, they can be attained with a minimum number of animals, look at the statistical power analysis, and then this minimum will be preferred instead of extending experiments to bigger number of animals, because if only a few can give or can allow collecting results that can be reproducible. So why not looking at the least minimum of size of population in this experiment to allow other animals to be safe, to be spared from potential harm, potential suffering, distress. And then we look at the refinement. The refinement refers to methods to reduce pain and distress. These are technical part of the experiment. These are the experience of the research team. These are also the facilities that are being used, whether the facility can allow milder impact of research, impact of handling to animals. But also there is anesthesia that can be seen as alternative measure to alleviate the stress. So there's actually this 3R assessment is a requirement in all proposals. In everywhere, there are many, let's say, style or let's say systems in the IACUC. Can be American, can be UK style, can be Australian style. All these variant guidelines and the procedures, they converge to the imperative to go through 3R assessment for all the proposals that are submitted for IACUC assessment. So here's the details about the principles of 3Rs. The 3Rs have been developed over the last 50 years, but now they are being revised to include new consideration for modern research environments. You know, there are modern research that are actually using more and more animals, especially with the vaccine development, especially with modeling of diseases. So all this actually they have been refined, and there is an improvement, ongoing improvement that actually is being proposed. And this we have seen the first in the principles of human experiment technique. This is a big manual that is very new, written by Russell and Birch. They have proposed refinement to existing 3R principles that were actually developed 50 years ago. And we see that in the refinement, here's a video, you can play this interactive script to get more details. For those who are interested, you can get the slide, and then or you get we can provide the link for that, and then you listen to this script with additional details. Otherwise,
presentation provides an overview of the.
So you go there. You can check later. You see the improvement in replacement, for instance. The replacement has improved it with accelerating development and the use of predictive and robust models and tools based on the latest science and technologies to replace the use of animals, for instance. So the avenue of AI can be very, very successful in this area, where the models with robust models, because these models, they yield result that can be reproducible. So anyone can use the model and change the parameters of the model and look at the outcome. That's actually different outcome depending on the research objectives, rather than replicating the same experiment with animals. It's like experiments have been conducted once, and the data have been collected from various sources, and this data can be used to model, to have these model tools, and to provide insight, to provide element of research of experiment without using animals. This can be very important to address important research questions where they would have otherwise been used animals. For reduction, have seen the refinement in terms of appropriately designed and analyzed animal experiments that are robust and reproducible and add to the knowledge base. So it means there is a reduction of the frequency of use of animals. So, and we have seen refinement that is updated with advancing laboratory animal welfare by exploiting the latest in vivo technologies to minimize pain, for instance. Technologies, non-invasive technologies to minimize suffering and distress, and also to improve understanding of the impact of welfare on scientific outcomes. We have seen this in vivo technologies that's actually being developed in the area of surgery, for instance, in the area of diagnostics, using technologies that are minimizing the pain with minimum level of invasion to organism. So you have also full replacement, partial replacement. You can go through this slide and get more insight about this. And also reduction. To reduction, we have seen a growing recommendation to consider data sharing between research groups and organizations that contribute to the reduction. Since, for instance, some experiments have been conducted in some part of the world, and look at your research experiment, you look at the setup, you see that there are similarities, even though the objective may differ a little bit or may be customized or can be contextualized to the area or to the context. But still, you can use data from other sources. This has been done a lot in the molecular biology, characterization, in molecular epidemiology of some diseases and pathogens. So this is another alternative to reduce the exposition, to reduce the impact of research on animals. Very important point of view. And then also look at the number of animals. This is where we have we talked about the power, statistical power of research and analysis. Look at the animal, the number of animals are scientifically justified. Not too many for ethical consideration, but also not too few. If you have a few animals, that's actually not meeting the calculated power, statistical power. It means the result may not be reproducible. The result may not be valid. And if you engage animals for a study that will not be validated at the end, it means not publishable result, result that cannot be reproducible. So is a waste of resources, including these animals, unfortunately. So there is a need really that IACUC looks at this and state and recommend on the right size of population animals to be used. So sometimes more animals may be justified to reduce suffering per animal. For instance, in the case of, for instance, the frequency of interventions or procedures, instead of having more high frequency per day on one animal, this and if this can yield the same result as considering doubling the number of animal or tripling or quadrupling the animal number of animals and to get the same results. So the choice will be to have double or triple size of the animals with half of the frequency of intervention per animal per day. And then you look at the management of distress, pain, distress, welfare, how the management can be assured. I look at the level of the pain and also the management. Look at possibility to make to use anesthesia, analgesia to reduce pain, but also look at the monitoring of the frequency of of uh, interventions, human endpoint, euthanasia, if euthanasia is the last really option. Also, in the proposal, these are the information that's part of the information that is really required and has to be aware, detailed in the proposal to be viewed, to be assessed. The committee then ensures suffering is minimized or is prevented. For better, you minimize, and for the best, you prevent the unnecessary suffering of the animals. And then also the committee has the mandate to look at the facilities, whether it's a farm for animals, whether it's farm for laboratory animals. All these facilities have to be also to come into the lenses of the committee to evaluate, to check. So, the field visits has to be organized, especially for an established institution, twice a year. It means minimum visit frequency 2 period, it means by semester, have to visit all the research stations that are under responsibility of the institution. I look at the housing conditions, the feeding, the water supply, the environmental enrichment. Look at the monitoring system that is in place. Look at the emergency plans. For instance, not to lose the material and for instance, in the case of power shots and all the samples are deteriorated, they are destroyed, they're spoiling. So that may imply reproducing the same experiment, the same measurement, and also exposing again the animals. So their level of housing, the facilities, quality and safety, that's really, really very important to be assessed by the IACUC. And then the last, not the last, but not the least, is a capacity building, the training. Of course, the members have to get a competency and a trend in terms of understanding the animal welfare, understanding the animal ethics parameters, the concept. They have also to understand some legal aspects that are bound with the use of animals. And then they have also to understand their responsibilities, because the team has to work with the responsibilities, has to be provided with the leadership. It means the committee coordinator or the team leader, but also every member of the team has to understand his role, but also what is responsible for. That's why as I mentioned, the first activity of our established new IACUC was to organize an orientation session. The orientation was meant to equip them with the basic knowledge and the skills, how to manage the committee responsibility, how to understand the responsibilities, but also how to provide the sense of urgency and also leadership to this committee to understand the biggest role that they have to preserve animal care and also the ethics with the research. So here we come to the process as after all these various different steps, but also the levels of guidelines, manuals. So we look at now at the assessment itself, the process, from the discussion of the project, purpose, purpose and benefits, evaluation of alternative. This is 3 R's: review procedures and the welfare impact, looking at some question, but also suggest refinements. That's why in the any of the review process, there will be a session. There will be a viva voce session or presidential or physical session with the research team to hear from them, to get all the required information, to understand the gaps, and also to take some decision together regarding the animal ethics and animal well-being and ethics. And decisions, of course, decision by the IACUC decision have to be done by consensus. There have to be discussions and then consensus. If there's consensus, then majority can vote. The vote is the last option, because when there is a vote, there should be some levels of, let's say, a bias, personal bias, or there is a potential for bias. That's why the consensus decision making is the best option. That's why everyone understands really that if the project is approved, the team is responsible for the animal, for the care, disposition, but also for the ethics in the use of animals that will be involved in the research experiments. After this, once the project has established and implementation starts, there is also the monitoring and evaluation of the project to look at what was agreed on during the project review. What was recommended has been scrupulously implemented. There was no, let's say, gaps in implementation. There was no, let's say, omissions, oversight. Everything has to be straight as agreed on, as approved, and also recommended. That's why the monitoring has to also go back to site inspections, look at the experimental setup, look at the level of compliance to existing standard, basic standard of animal welfare, the nutrition, all the conditions have to be met for the research to be only concentrated on the research objectives and also the factors of research itself, to minimize the environment impact on animal welfare, or to minimize the individual of animal impact of animal welfare of a single animal, individual, or a group of individuals, animals. And then, of course, the compliance is the key. When there is no compliance, all the activities must stop immediately. It means the IACUC should issue the notice of closure of the project. And this notice have to be shared with the institutional authority, so that the compliance, but also the enforcement is being done. Sometimes also the corrective actions must be implemented. Can look at the refinement, look at the reduction, for instance, look at the environment compliance. So there are many actions that have to be done, but compliance the key in all the decision taken by IACUC. So the IACUC has the mandate, but also the power to impose compliance. So at the end, we can summarize. The IACUC must always ensure animal use is justified, the welfare is prioritized, the pain is minimized, alternatives are considered, the 3 Rs, the science remains valid and responsible. This is actually objective of conducting any research projects. And this has to go through there's a flow. The flow started with the proposed submission, and it ends up with a decision: approve, modify, or reject or reject. And if you have an approve or modify, we approve again, and then you go post approval monitoring, and the cycle can be allowed, or the cycle can be stopped there if there is no way to assure the required compliance. Of course, there are some challenges, even though the institutional animal care and use committee guidelines, they are designed to oversee the ethical treatment of and human care of vertebrate animals in research, testing, and teaching. So we all agree with this. It's really imperative and very important. Is human, but there are always challenges in the implementing this flow of animal fare guideline and also compliance. Especially look at the IACUC itself, how it works, the legal and institutional support. We look at the also the gap in matching one animal fare with the one else, because all is actually interconnected. And once we oversee, or once um, we do not consider some aspect, we lose a lot on the other side of our life, in the health. For instance, if you look at institutional support, one of the foreseen challenges in the IACUC implementation, but also in the management of it, the activities, is a budget, of course. Once the institution has established in the IACUC and has also given them responsibilities and the power, they have also to assure the resources are appropriately provided. This is where the discussion come in, because it's an additional budget line that is entering through institution planning. There is also the training of IACUC members. Members have to be given the opportunity to be trained, but also they have to accept that actually this training is worth enough for their prestation to be done with the highest standard, but also to be able to work appropriately with partners and the researchers. There's also the feedback. The feedback of the partners, it means research teams to the IACUC. That sometimes feedback may not come as a positive, as a constructive. They may come as an attack, as like a assault to the IACUC. Your decision are not fair. There is a bias. There always discussions. Sometimes can be bitter discussions, and this is not good for a research and education environment. So the IACUC must be able to manage, and if not, they can refer the case to the overseeing authority. It means the institution that has appointed the IACUC. So these are the management, the operationalization, but also we look at challenge in the framework. For instance, if you look at this an example in the US, one of the institutional IACUC animal care and the use committee was established with all the ingredients. And this is a flow, legal flow, that actually is indicating, let's say, the legal framework that gives the power, that also gives the latitudes for compliance, for enforcement of compliance to the IACUC. And as you see, for instance, we have this animal welfare rights, but also the acts, but also this public health acts with NIH. These are like a legal instrument at international level. But you look at the institutional level, also our country level, sometimes you have a gap in the law or in acts or any regulation that will be backing the IACUC implementation, but also operationalization. Because some cases may require a legal advice or even a legal pursuit. And this case, there is a gap in many countries. I remember that with discussion I have with my colleagues here, we understood that Rwanda is also developing animal welfare law. This will be a very instrumental legal tool to be actually used to back our own institutions. Otherwise, we can still using the law establishing our institution, our respective institution, but this law has to be complemented absolutely by animal welfare related law or any regulation. Can be a policy or can be act, something like that. So this level of institutional and legal support has to be there to give also to give this IACUC the due responsibility, but also the power to make use of the terms of reference and also take some important decisions. And then also we need to understand that animal welfare is not isolated. Sometimes the awareness is lacking. You know, everything we do, we need to understand that when you talk about ethics, ethical consideration with when we use animals, when we handle animals, we have to understand this. These are sentient beings. Sentient beings means they may behave at some extent, to some certain extent, with like human do. So they require a level of consideration when it comes to the exploitation, level of exploitation. And they look at the benefits that actually may be missing if we oversee or if we omit to observe these basics of basic animal welfare consideration, is that we are losing on the public health benefit or food safety, for instance. With animals are neglected or exploited to the maximum, animals are used to make them weak, sick, or distressed. So the results that we may not have um, the benefits that we are looking for when it comes to public health and also safety. They can confer the disease, they can be improper for consumption, they are product improper for consumption, and yet we should also look at this additional benefit. There's also environmental benefits. The improved soil, water health, improved resources consumption. We look at the environment, the improved environment, and also we can get maximum of input from this environment as a farm, for instance, waste, or as a farm second production or byproducts. There is also economic advantages. More efficient, healthy animals, they are also yield increased production, outputs, and the quality of outcome. So all this has to be seen as, let's say, complementary approach so that we can get the benefit, but also preserve our health, like when health matter always. Yet I will not go without sharing this thought. Is as old as 19th century. We have a philosopher that who called Arthur Schopenhauer, and this philosopher introduced an argument that men are the devils of the earth, and the animals are the tormented souls. So should we look at the side we should place ourselves, either on the side of devils on this earth, or act with human consideration to animals? As we have seen this, once the animals are well treated, they also outcome to health to economic, to there are many benefits that you could actually get from considering the basics of animal care and also consideration for animal ethics. Ethics in working with animals, ethics in using animals. So with that, I would like to thank you so much for your kind attention.